Hi, my name is Ayan Mahmood, a project support officer working with the Bolder Healthier team. Today, we will be discussing keeping safe, well, and warm for the upcoming winter months as part of the Bolder Healthier Winter webinar series. So, keeping safe, well, and warm. As temperatures drop in the winter, anyone can be impacted by the cold as it can cause long-term health issues to develop or underlying ones to become more serious. The cold weather brings a number of risks. As people spend more time in close contact with one another, flu, coughs, and colds are more easily spread. The cold makes health conditions harder to manage. It can affect our heart and its circulation. We are also more inclined to comfort eat and do less exercise in the winter months. The good news is there's lots that we can do to keep ourselves well this winter, which include getting vaccinated, washing our hands to avoid the spread of germs, coughing and sneezing into the crooks of our elbow rather than our hands. So, what effect can the cold weather have? The cold weather can make health problems worse or even lead to more serious complications, especially if above the age of 65 or have long-term health conditions. It's important to stay protected against a drop in temperature as cold weather can affect our body's ability to fight off viruses or infections. Weakened immune system can spread the cold or flu easier. So the recommendation is to get the flu jab, wash your hands frequently with soap and water, use hand sanitizer, and cough or sneeze into the crooks of our elbows and not our hands. So there's also a risk of hypothermia in which the body's internal temperature falls too low. So the recommendation is to bundle up when going outside. Be aware of the signs that your body isn't handling the cold very well, such as a stiff neck, arms, or legs, and call 111 if you suspect yourself or anyone is suffering from hypothermia. So the cold weather can affect balance, so the icy roads can make falling easier, putting you at risk of fractures. And finally, dry winter air can suck the moisture from your skin. So it's recommended to use a moisturizer with an oil base to block evaporation, shower in lukewarm and not hot water, and use a humidifier to replenish moisture to the skin's top layer. So who's at risk of the cold weather? The NHS have stated that some people are more vulnerable to the effects of the cold weather. This includes those aged above 65, children and babies under the age of 5, those with long-term health conditions, people with disabilities, pregnant women, and those that have mental health conditions. To read more about those who are at risk of the cold, please visit the link in the slide deck. There's also a link to the Met Office guidance to find out further support or information about the cold weather. Local response. So Birmingham City Council is continuing to develop a range of support for residents over the coming months. We have opened a series of warm welcome spaces which offer a range of services. Please check the council's website and follow our social media for regular updates about what is available. Connect to council support. Birmingham City Council's contact centre is open from 9 a.m. to 5 p.m. Monday to Friday and supports on a range of topics, including support with emergency food, benefit inquiries, council tax inquiries, accommodation for the homeless, and they can be contacted on the number on the slide deck, which is 0121 216 3030. There are also 2 walk-in centres, which are the one on Sutton New Road in Erdington and the one in Northfield. Please check out the website for information about opening times and the support offered. So staying warm. Keep warm by putting on a coat, hat, scarf, and gloves when you go outside. Use a hot water bottle or an electric blanket to keep warm in bed, but do not use both at the same time. Have at least one hot meal a day. Eating regularly helps keep you warm. And there is information on guidance on how you can make efficient and quick meals. Also, stock up on non-perishable food items. Have hot drinks regularly. Industry sources recommend an annual check of the heating and boiler systems by a professional to help with energy efficiency and maintenance. Usually, servicing during the winter months is better as it avoids a faulty boiler during the winter months. Further advice is close curtains at dusk to help keep heat in. Keep bedroom windows closed at night when the weather is at its coldest. And also, babies can also be susceptible to extreme temperatures. To reduce the risk of sudden infant death syndrome, babies should sleep in rooms heated between 16 and 20 degrees Celsius. Keeping warm. The UK Health Security Agency advises to heat your home to at least 18 to 21 degrees Celsius. Ensure you have non-perishable food items, medications, and warm clothes. Check if you're eligible for help to keep your house warm. And also you can read a range of additional advice on the UK Health Security Agency's government website. So support with heating and energy costs. You may be able to claim financial and practical help with heating your home. Ensure you have efficient heating systems that you can control easily to help reduce fuel bills. Check if you're eligible for grants on the government website via the winter fuel payment and the cold weather payment. Industry sources recommend an annual check of the heating and boiler systems by a professional to help with energy efficiency and maintenance. There are advice on how to save energy in your home, and there's also a number for a helpline. You can also find out about the benefits and the financial support for low-income households on the government website, which will be included in the slide deck. Staying safe. If you are going outside in wet or icy weather, wrap up warm, including wearing a hat and gloves, wear sturdy non-slip shoes, use a walking aid if that helps, ask for support if needed, and don't take unnecessary risks. The UKHSA advised to speak to your GP, a pharmacist, or a carer for advice, and keep in touch with friends, family, and your community. Look out for others, especially those most vulnerable in the community. Ask if they require assistance for shopping or for a general chat. Winter times can get quite lonely, so going to have a chat with someone who needs it could combat loneliness through the winter months. So the order of advice: if you need help on medication, speak to your pharmacist first. If you need medical advice, speak to your GP. And if advice is needed for more urgent medical matter, call 111 to speak to an operator for advice. So staying well. Stay as active as you can. Any exercise can bring health benefits. There's further advice on the Age UK website. So keep moving. Try not to be stagnant for more than an hour at a time. Little movement can often help maintain strength and mobility. Start simple and build slowly with home-based exercises that you can add to. Another advice is eat and drink well, plenty of water, and eating a varied diet, including fruits and vegetables. Eating healthy helps us attain better mood and energy levels as it improves our emotional and physical health. Eating well and having a healthy lifestyle helps us feel and bring a big difference to our long-term health. You can do things such as keeping sweets as treats and also keeping your cupboard stocked with the basics in case you can't go outside due to ill health or bad weather, such as non-perishable food items, cans, pastas, that type of thing. Ensure you continue to take appropriate medication and supplements. And respiratory illnesses are more widespread in the winter, so it's important to stay up to date with vaccinations. For more vaccination advice, visit the NHS website. So you're eligible for the COVID-19 booster vaccination if you are above 50, and you're entitled to the flu jab if you're above 50, a carer, have an underlying health condition, or are immunocompromised. There's more further information on the NHS website to guide with that. So, get advice if you feel unwell. If you're 65 and over, in an at-risk group, seek medical advice as soon as you feel unwell. You can get help or advice from a pharmacy. Pharmacists can give you advice and treatment for minor illnesses and can advise you to see a doctor, your GP, via phone or appointment if needed. NHS 111, 111 if you have an urgent medical problem and unsure of what to do, and call 999 if you have a medical emergency that requires immediate attention. The sooner you get advice, the sooner you're likely to get better. So, helpful resources. On this slide, there are a series of links to help spread information. So, Bolder Healthier Champions. The role of the Bolder Healthier Champions is to disseminate information into your communities to engage, encourage and support health and well-being. You'd be supported by monthly themed webinars, tailored resources packs, health awareness training. To join, please click the link on the slide deck once distributed.